moving on to the next segment, which is the educational session of osteomyelitis. And with me here is Dr. Kwame Nimarko-Antwi from RMM Clinic. Okay, so moving on to the next segment, which is the educational session, I would like to know, as a medical student, what are the things I'll be expecting when I first encounter a patient diagnosed with osteomyelitis?
Okay, so medical students, usually the complaint will be more like a bone pain. So then usually you want to have a couple of thoughts in terms of possible diagnosis. That will come like a long list to some degree. Then you want to look out for what are the things that make it osteomyelitis, what are the things that make it not osteomyelitis, make it other things. So for instance, anybody has come in with a bone pain, let's take our mind to the market.
Okay.
So for instance, if it's a blood-related problem, let's say somebody with sickle cell anemia could have a bone pain, so it could be sickle cell bone-related crisis. Now, somebody who has, let's say, rheumatoid arthritis could have a bone pain. Somebody who has other diseases like SLE could have also bone pain. Now, with a bone pain could also be from trauma. Maybe the person fought with somebody, hits his hand, so you also will verify from the clinical history what were the prior incident before the person started developing it, so you would get to know what it is. Now, too, it could also be that this person probably developed some related bone issue, never gave it attention, and now coming in with a pain. So it could be maybe like a chronic pain the person had. So every medical student would end up having more like possible differential diagnosis. That is just to skew down to what the problem is. So the main thing you also want to look at is because it's an inflammatory reaction, usually you would have more like some reddening depending on the skin color you could see or you could not see, some bone pain, some swelling of some sort, and then the person may, depending on where it is, will affect some range of movement. So with that, with the medical student, you'll be able to figure it out what it looks like, okay, what is causing what. Now, the other thing that we can say that the person has already been diagnosed as osteomyelitis. What the medical students, back then we tried to do is, okay, what is making it not something else? So then, I wouldn't say luckily, but the patient is there. So then you would want to look at the hand, where it is, then look at the x-ray, realize there's some changes there. If the person has come in early, likely the x-ray will be on the wall, so you can see on the x-ray clearly. You can see the signs that we describe, usually per the clinical textbook. So then it becomes much more, practical. Wow, this is involucrum, this is equestrium, and all that there is. So they can actually see it and appreciate it. The only thing is that somebody is there unwell, and you've seen it, and you're happy. Because it's in the textbook and you've seen it, it's somewhere, it's funny, but it's some excitement because you've seen the textbook and it's right before you. But for purposes of, person becoming a doctor, needing this information to be able to diagnose early, treat other people well, so they also do not develop other complications, so to that their benefit.
And then also, what first aid tips would you recommend to these medical students?
So usually, when it comes to first aid tips, to give another or for them to becomes dicey. Because usually as medical students, we are not doctors yet. So for first aid therapy that they can do or advise, maybe you have a pain at the side, maybe wrap it with something, get to the nearest, because you don't know what it is. For instance, the person starts experiencing pain following a slip. The person can probably put some firm, wood or something on both sides, bandage the hand, get to any close by clinic. Because the person cannot really, you have to take as much precaution as possible. And then the other thing that one can do, first aid wise, any bone pain, when it comes to moving the hand, one has to be very careful because it could be a fracture. So you always want to be careful just not to cause further pain. And now recognize the person has a pain, some disability. You should always understand that this person may have some predisposing issues that is giving the person that related problem. So that's in the long term, following discharge or following other discussion, can give some advice so that the person would follow subsequent treatments at clinic.
Still on the educational session, I'd like to know, have there been any collaboration with educational institutions and research institutions in terms of enhancing the treatment and diagnosis of osteomyelitis?
To the best of my knowledge, I'm not aware.
Yeah, not aware. Okay, so I'm a medical student. I've done a research and then I've come up with an output. And how best or how can I bring out this research to other medical institutions so that they can grasp it and then also enhance treatment?
Okay, so what it is that, I mean, I can only say by word of mouth and because luckily in our clinical setting, we are lucky to have, should I say, consultants that are very nice people and they're open-minded. So let's say as a student you've come up with, I'm sure definitely this student may have had a supervisor, you know, and who is more like a consultant. And this idea, at the consultant level, they have discussions. But if let's say this medical student probably has done some readings, have come across this and that, often we have these discussions like rounds within the school. And if you bring it out, you know, a good idea, we all look at it, we discuss it, it takes you to another level. When it comes to collaborative research, that's where I'm not really aware of what currently is happening.
All right, your last words on osteomyelitis.
Yes, so what I want to say is, any little wound could develop osteomyelitis.
All right.
Anybody stand at risk of developing osteomyelitis, despite the fact that there are people that I made mention that they tend to have predisposing factors, including the fact that the medication they are taking, or they've had some surgical procedure that predispose them to getting it, or generally they have some reduced immunity, sickle cell anemia of some sort. So many a time we would advise that anybody who develops any small wound, give it attention, such that it doesn't develop into another thing. It doesn't develop into another. Nobody is, you know, nobody is, you know, can stay away from getting it. But once we all do the due diligence, small wound, give it attention, get well, you part. The one you just gentle, you know, and then become something else. The other thing I also want to say is, should there be a need, one develop any bone-related issue, one should make sure they report to the hospital, any near clinic as soon as possible. Upon reporting, they will do the assessment. If there's one that they can manage there, assuming it's more like an acute one, they can manage there. They manage you, and then when you are fine, that's about it. But they realize that, you know, not something that per the health system they can manage there. They then refer you. Would advocate that once they are told that they have to stay in hospital for quite a while, they really need to accept. In that the complications are not pleasant, and nobody wants to have, you know, issues related to the bone, because that is what makes us move. That is what assists us, you know, in so many ways. So when you have the chance, don't want to waste it. Take care of the wound. Don't get the osteomyelitis. And if you develop anything, visit the nearest hospital, get the nearest treatment, and you part your way.
Okay. How about a little advice to our medical students?
Well, when it comes to osteomyelitis, any bone pain, definitely you should include osteomyelitis as part of your differentials, such that, I mean, you would always want to make sure that if it's not osteomyelitis, probably it's VOC, and sickle cell vaso-occlusive crisis. If it's not sickle cell vaso-occlusive crisis, maybe a fractured bone, depending on the circumstance. So as medical students, you always want to make sure that, you know, you have your differentials well outlined, and then you have your important positives and then important negatives, such that once you see your patient, you will be sure that this important positive is it there. This important negative is not there, and you know that it is not osteomyelitis, it is something else. Oh, it's osteomyelitis, let's see it. And then the other thing is that it's not everybody that will develop a wound and then have osteomyelitis. The person may probably have had hematogenous. Maybe the person suffered some prior, you know, upper respiratory tract infection, or probably the person had maybe more like some infection that, you know, was not close to where the pain is. So at any point in time, any bone pain, osteomyelitis should be a differential there.
All right. Thank you very much, Dr. Nimarko-Antwi.
You're welcome.
Thank you for having us, and we hope to have you again on HealthAfrik. We've come to the end of our discussion on osteomyelitis with Dr. Kwame Nimarko-Antwi from RMM Clinic. If you just joined, we discussed osteomyelitis. We looked at the causes, we looked at the symptoms, some types of osteomyelitis. We also looked at the diagnosis and treatment, and then the educational session. You can go to our social media handles, Association of African Universities on Facebook and YouTube, AAUTV_African Universities on Twitter, and AAUTV official on Instagram to listen. We hope to have you again in our next edition. Bye.